You're good.
Okay. Hello, everyone. Welcome to another Fresh Dental Shadowing session. Tonight we have Dr. Rubina Saman. She will be sharing her experiences, and then we'll move on to a Q&A at the end of the session. So, Dr. Saman, when you're ready, you can start.
Great. Hi, everybody. It's great to be here. I'm honored to present today, and I want to thank Hanan Abdul Khalil for inviting me to present today. And I hope you guys learn a lot and ask a lot of questions. Feel free to ask me anything. I'll go ahead and start. So, as Christina said, my name is Rubina Zaman, and I have been in practice as a dentist for the last 23, 24 years. I'm a practice owner. I've owned Garden Oaks Dental. That's the name of my clinic, and I've been there for about 15 years. And before that, I was an associate in a corporate type office for about 10 years. I'm practicing in Houston, Texas, in the Heights area. If anybody's from Texas here, I'm not sure if this is like national or, just local. But anyways, we're from Houston. Let's see. So today some of the things I'm going to be talking about is why dentistry as a field, why dentistry for me personally, the dental school application process. Keep in mind that I'm out like 24 years, so I'm pretty dated, but I do have some mentees that have just gotten accepted to dental school. So I did ask them, and I have had some mentees over the years. So, and I do this presentation a lot in the schools. So hopefully my information is up to date. Also talking about dental school in general, what that's like, GPR residency, because I did a GPR residency, which is a general practice residency, and how it is being out in the real world. Part-time baby, that's what I do. I work part-time, and that's one of the reasons I chose dentistry. So I'm going to talk about that, and volunteering and giving back to the community. That's another reason why I do it part-time, and that's pretty much what we're going to cover today. So education background wise, I went to UC Berkeley in California for a couple of years, and then we moved over here to Texas. I graduated from Houston Baptist University with a double major in biology and psychology. And then I went on to UTDB, which was at that time, that's what it was called, which was the University of Texas Dental Branch at Houston. And I received my DDS from over there. That was from 1994 to 1998. Now it's known as UTSD. I always have to remind myself what it's called now, because I just think it's UT San Diego, but it's really not. It's UT, University of Texas School of Dentistry. In Houston. I did a GPR residency for 1 year at the VA hospital. My sister is also a dentist. She was in dental school with me. We were in the same year, and so that was pretty awesome. Especially since she's a lot more organized than I am. So I relied on her to get me all, the dates and everything that I needed to do and all the research and stuff. So I used her. I'm proud of it. But anyway, so we're both dentists and we both practice here in Houston. She also did a GPR residency, but she did hers at through UT instead of at the VA hospital. So why dentistry? Dentistry is really an amazing field, and it's just very flexible. That's what drew me to dentistry in the first place. I was not drawn to, working in people's mouths or dealing with saliva. I really thought that was gross in the beginning, but the more I looked into dentistry, the more I became, I really felt like it was a good fit for me, for what I wanted in my life and the way I wanted to live. And mainly it was the flexibility that attracted me. And the thing about why I say dentistry is so flexible, it's because you can work for somebody else. You can work in corporate, you can work in private. So if you like a more fast pace, if you like a more slow pace, you can choose that. You can have your own practice, so you can be your own boss if you're good at business, or even if you're not, you can learn, and you can have your own practice, and you can have multiple practices, and you can go and make a corporate or do DSO yourself. So it's just so flexible. You can work full time, you can work part time. And so it just really jived with what I wanted to do. For me, Well, for me, the main draw was having time with my family. I wanted to have a good work-life balance. And so I knew going in that I only wanted to work part-time. And I've done that for the last 24 years. And, when my kids were younger, I was, really active in their PTO. I went on field trips with them. So it gave me that ability to be there for them as well as practice dentistry and help people. Really, with dentistry, you're helping people find their smiles again. And it's so important. It makes such a big difference in the way people feel about themselves. Um, and it makes you feel good when you help them. And it's not just about aesthetics and looks, it's also about function. Some people just really can't chew, they're in pain, and to get them out of that, to help them getting feeling better about their smile and their teeth, it's really rewarding as a field. And I was, pretty good with my hands. I liked art. I was kind of artistic, so I wanted to do something that would be good for that as a field. And you'd be surprised, like I really didn't know why there was such a big emphasis on being good with your hands. And but it is. And actually in my interview, when I got interviewed in dental school, one of the interviewers asked me, he's like, are you good with your hands? And I'm like, I had this whole thing memorized because we know they're going to ask you that. And I was like, of course, I take piano, I type, I do jewelry, I had these things. And he's like, yeah, but do you fix watches? And I'm like, no, I don't fix watches. But anyways, later on, I could understand maybe where he was coming from. So you do have to be good with your hands when you're a dentist. Um, Another thing with dentistry that is flexible is that you can do regular bread and butter, like kind of fillings, um, dentistry, type dentistry, or you could be a surgeon as well. So some of the fields like oral maxillofacial surgery, periodontists, they're basically surgeons. They're doing surgery, surgical procedures, day in, day out. As a general dentist, you're actually also a surgeon too, and it just depends on what you find your niche. You can be, the next point is clinician versus academia, research, forensics. You can be a clinician, you can just practice general, or if you want to specialize, and do surgical or endo or something like that, you can do that. You can also go into teaching, you can go into research, and if you like the CSI thing, and you can go into forensics. It's very interesting to me. Never done anything with it, but I find it interesting. It's just an exciting and constantly changing field. So that's one thing when you're a dentist. I mean, in any medical field, really, you're always going to be constantly learning. That education is never going to stop. And so we're always constantly taking CE courses, continuing education courses. You have to take a certain amount once you graduate. And it's just there's a lot of changes. Sometimes it can be a little bit overwhelming because when you're out of school for a while, and you haven't, say, in my time we didn't really do implants. I did get to do implants in my GPR residency, but not in my DDS dental school. And some of the programs now, they have those, they have implant trainings during your school, and you probably will have a lot more familiarity with implants than we did back in the day. So that whole change, that's different, difference in the way treatment planning, your patient, you have to constantly be updating your resume and taking classes just to have an idea of what's new in dentistry. And then giving back to the community. You with dentistry, you can give back to the community, dentally, uh, in a dental capacity, by helping people, in low income people, in some of the clinics that people who don't have insurance. And when you do that, you feel really, it's very rewarding. You can also, I know so many dentists who do other things. I know a dentist right now who's a councilwoman in Houston. I know dentists who are on boards of different organizations. And so you're constantly giving back to the community as a dentist, and that's a great feeling as well. This is my family right here. This is in San Antonio. This is our boat, and this is kind of all my parents, my brothers, siblings, and sisters, and my nieces and nephews. So that was my main reason for choosing dentistry, was my family and my family time. It's important to me. So applying to dental school, you need to make sure there's certain things that you need to check off and make sure that you have done to apply to dental school. And it is difficult to get into dental school. And every year I feel like it's more challenging. Just people are doing even better on their DATs and their GPAs. And so it gets more and more competitive. But you want to make sure, first of all, that you have all the prerequisite dental courses, and it differs from dental school to dental school. So you want to make sure that you check, like if you're in Houston, you want to make sure, or Texas, you want to make sure and you're going to apply locally to Texas, you want to make sure what are the, Texas dental schools requiring, and go by that as a checklist. Don't just go by like some other state and then think that you're going to be covered. So you want to make sure you look into that. You also want to make sure you take your DAT. So the average UT School of Dentistry in Houston 4 years ago was 22 for the DAT, and they're pretty high up on the DAT. It's difficult to get into UTSD with a lower not a lower than 22, but it is with a low DAT. It's kind of difficult to get in. So you want to make sure that you are competitive with that, and you don't want to be afraid to take it over again. You want to make sure that if you don't do well, try it again and do it again until you get a better DAT score. It's important, especially if your GPA is not that high. You also want to make sure you keep your GPA up as well. And the average 4 years ago with the same class as the DAT, their average GPA was 3.81, which is also pretty high. But you'll find differences in different states. And I know one of my mentees last year who just got in this year, so proud of him, and you'll see a picture of him later on. He's at UT San Antonio right now, and he was telling me that their average was 21.5 on the DAT. That's for this year, and that their GPA average was 3.75. And I think in our day, which was again like 23 years ago, our average GPA was at 3.71. So it's still on the high side. And our DAT average, I think, was 20, I want to say 20.5. And that was like way back when, but it was, still pretty competitive. You want to make sure that you have a well-rounded, extracurricular activities in different classes. You don't need to major in a science with DAT, but you have to take the prerequisites. So a lot of times it's easier to do science major and then, get the prerequisites that way, and you don't have to do extra. But a lot of times they like to see that the candidate is well-rounded, and it's nice to have different extracurricular activities. You can join some pre-dental clubs. If you do research, that's always good on your resume. It doesn't have to be dental related. And just joining other clubs that are maybe like of interest to you as well. It just shows that you can make time, that you're able to balance your schedule, and it shows them that you're capable of, doing just more than studying all the time. You want to shadow. So I shadowed at Schiffer Clinic way back when, and I'm going to talk a little bit about Schiffer Clinic because I still will volunteer there as a dentist now, but I shadowed one of the first dentists who started that clinic. And that's a clinic for people who don't have dental insurance and who are working poor. Basically, they don't have a high income as well. So you want to shadow either at a dental office, a private dental office, or at a clinic that is, a clinic like that that serves people who are underserved and in need. So shadowing is really important, and that's another thing that I didn't think it was that big of a deal, but later on I wish I had shadowed more. I shadowed a little bit at Schiffer Clinic. I never shadowed at a private practice, and I really wish I had gotten that experience, because Schiffer Clinic, like I said, it serves the underserved and the needy, and so there's few procedures that they do. They don't do all procedures, right? So they do, basic procedures like fillings, extractions, cleanings, but there's a lot that I missed when I was doing that. So I would give advice, to try and shadow a couple of places, and to definitely try and shadow a private dentist. I know for y'all, especially this year and last year, is so hard to get shadowing hours, and that's why this is amazing. Whoever thought of this to do the virtual shadowing is great. I know, because I know a lot of people are still not accepting people to shadow. We did start like about 3 months ago, but this is a great opportunity to get to know some dentists. Obviously, you're not seeing procedures as much, but they do have the case studies, so that's awesome as well. So we went over the GPA, the application. You want to work a little bit on that personal statement. When they first, from what I understand from people I know who work at the dental school admissions, they basically go through the applications and they kind of weed them out based on DAT and GPA, but then they look at the personal statement, and you want to stand out in that, and you want to make sure that it's well written. And so you want to take time and do that. And it's hard to write a personal statement, especially if you're not organized, but you want it to be about yourself and about your real authentic you. I really tell people, don't like try to be somebody else. Come across as yourself and let it stand out. I mentioned that I was a Muslim and I had a mixed background. um, on my application. I wasn't worried about, and I think that it's good to always don't be afraid to be different on the personal statement. The interview, I mentioned about how my interview, like, well, I had a couple of interviews, but the first interview I told you how that one person, and I had like I think 3 people interview me on the first interview. And the one who asked me about do I fix watches, that one went well. I mean, other than the fact that I didn't fix watches, I mean, it went relatively well. He asked me all the questions that I kind of thought he was going to ask me. But I did have one interviewer who, it went really bad. It wasn't like bad, but he wouldn't let me speak. I basically said 2 words the whole interview. And I knew when I left that interview that it didn't go well. So he basically, like, he asked me if I shadow, and then he asked me if I went to Texas A&M, which I didn't. And then he went into all about Texas A&M because he was an Aggie and his son was an Aggie and his whole family were Aggies, and he talked about A&M, which I have nothing against A&M. But I didn't go there, unfortunately. And so the whole time he just kept talking about A&M, and he didn't let me get a word in edgewise. So I knew when I left there, he didn't learn anything about me except that I didn't go to A&M. And so I knew it wasn't a good interview. So I kind of, when I got back home and I asked a few people, I was worried, like, to ask for an interview again, to ask for a re-interview, because I knew that interview didn't go well. But I also wanted to be a little bit diplomatic and, not say, hey, the interviewer didn't ask me anything, and really, like, didn't give me a chance to express myself or why I want to go into dental school or anything. So you want to make sure that you ask for an interview in a diplomatic way, I guess. But don't be afraid to ask for a re-interview either. I was so glad that I did, because when I went back for that re-interview, somebody else interviewed me, and they told me that my mark was really low from that one interviewer, and it was a good thing that I had asked for a re-interview. So sometimes, if you know that the interview doesn't go well, and you can sometimes tell, sometimes you don't, but sometimes that it's like, okay, I said 2 words literally, like no and yes, and so that's not going to tell you anything about me. So I knew that didn't go well. So I just always advise people, if you feel like your interview didn't go well, don't be afraid to ask for a re-interview, but do it in a diplomatic way. Kind of, I wasn't feeling my best that day, and I really would like to re-interview, and something like that. So, where to apply? Once you finish your application, then you have to decide where to apply, and you want to see, like, whether you want to do in-state versus out of state. Some people come from very rural area, and they don't have a dental school close to them, or the dental school is not like in a large city, and they want to be in a bigger city. So maybe if you know that and you want to have a different experience, you can apply out of state. I think it's always better to apply in-state and out-of-state and cover all your bases. You want to choose a few schools maybe that have a reputation being a little bit easier to get in, especially the private schools, because obviously you're going to pay more money, but they're not as selective as some of the public schools are. dental schools. So you want to be cognizant of that, and you want to make sure that you kind of cover all your bases. For me, I wanted to I only applied in state actually, but having said that, my son is in the application process right now, and I'm telling him to apply in state and out of state. um, I knew I wanted to stay in state, and that's a picture of me on my graduation day when I graduated from dental school. And that's my sister. She's 4 years old, so she was born right before dental school started. And for me, it was really important that that she'd know me, because if I had left, and she would have not known me at all, because I got married right after dental school. And so that was really important for me, that I stay local. I applied to all the Texas dental schools. I got my interview for San Antonio, and there's three here in Texas, and I got my interview for San Antonio and Houston. Um, and I got accepted to both of those before I got my interview to Waco. So I didn't even go to Waco, because I already knew that was my third choice at that time. Not that I have anything against Waco school, but at that time I had gotten accepted to both of those, and so they were obviously higher on my list. Now San Antonio ranked number one, but I decided to stay in Houston, because again, I wanted to be closer to my sister. Also, for me, loan, I didn't want a loan. I didn't want a big loan, and that was really important for me. I didn't want to come out of dental school with this huge loan, and so I chose to stay in Houston, and I actually stayed at my parents' house during that time, so it helped a lot in cutting my cost of living and stuff. So we did come out both, and both me and my sister were in dental school at that time. So both me and my sister came out with a pretty low, relatively low loan. So that was a factor as well. In Texas, and I think in a lot of the different states, they have their own, application thing where you can just apply to one, have one application. So I know they have TMD, SAS, physicians and dentists and veterinarians in Texas all, do their personal statement and fill that out and send that in. And then you apply to all the dental schools in that state. So I definitely, recommend doing that. That's pretty easy, and that's one application. So that's, a lot easier. And then, choose a few schools from out of state, just like I said, to cover your bases. Location affects the patient pool as well. Like I said, if you're in a big city, you have a lot more patients, and they have, sometimes if it's a more like if it's a more rural area, you're going to see a lot of different populations. So it's, some people will want to go to a school that's in a big city. Cost of tuition, that's also a factor, and you should go ahead and look at different dental schools, and find out how much they cost, how much it's going to cost you for the 4 years, and factor in the cost of living as well. And just know that ahead of time, like, this is, how much you're probably going to pay in loans, after dental school. And so that should be an important factor as well. A lot of times, I'm just going to say one thing about dentistry, that's kind of a negative, is that in the last 23 years, the cost of like a crown, for example, hasn't gone up that much. I know people complain about the cost of dentistry, but that's mainly because there's no insurance. But really, the cost of a crown has barely gone up since I've been out in 23 years. It's pretty much almost the same price as it was when I came out of school. So there hasn't been that much inflation in the cost. There's a little bit, but it's not. But the dental school is almost 4 times what it was when I was in dental school. So you want to make sure that you don't have this huge loan coming out of dental school. Clinical training, you want to make sure, like, if you're interested in implants, but you still want to do just general practice, some of the dental schools have implant training in the dental schools. So you want to check and see if that's, an option for you. And you can check out their residency programs, and see how, well they are, if that's something you're interested in. And I covered minimized loans. Okay, so specializing. So you're done with your 4 years of dental school. And one thing I'm going to just say about dental school, dental school, each school is a challenge. When you go from high school to college, it's not necessarily that college is harder. It's, you have to be more organized. You have to kind of be on top of things. You're going to be, you're on your own, kind of, nobody's holding your hand and walking you through it. And the same thing with dental school. It's a whole new beast and it's tough. I mean, really, for everything, when I was applying to dental school, I mean, I really didn't have too many problems with school, with my grades or anything like that. I'm not trying to show off or anything, but and then most people are competitive in dental school, but it was tough. Dental school was tough, and it's very overwhelming in the very beginning. And it's not just studying. You have to be a people person. You have to study. You have to be organized. You have to do lab work. You have to also be seeing patients, so you're scheduling, you're calling, and things, I'm sure, are a lot more easier and streamlined now, but it's tough. You're juggling a whole bunch of things, but it's good preparation for dentistry, because you're juggling all the time, so get used to it. But so you finish the 4 years of dental school, and or longer, but or shorter, because some of the programs are a little bit shorter. So now what? Now either you graduate and you decide to go into just general practice. Just go into practice, which you can do, which is awesome. Or you can do a GPR or AGD program, which GPR is a general practice residency, and that's what I did. And it's more hospital based, so that's great as well. And if you can just tell me about the time, because just keep me on track with that. Oops. No, it's not letting me go back.
Yeah, we've been live for 25 minutes. So
Okay. It's not letting me go back on my screen. I'm not sure what happened. I don't know what I did. Here, let me see. Okay. There we go. Okay, sorry about that. Okay, so specializing, there's so many, and that's one of the amazing things about dentistry. And actually, one thing I thought, like, before I got into dental school as well, I was like, how long does it take to teach you to make a hole in a tooth and fill it? Okay, like, I mean, how can we be in 4 years of dental school? Like, I mean, I'm sure that takes like 2 months to figure out. But no, dental school is like, I mean, you need 4 years, and you need sometimes plus. Okay, that's probably one of the reasons I went into the GPR residency. I felt like I needed a transition, but it's just, like everything in medicine, there's people who, podiatrists, focus on the feet, and they study for like 7, 8 years, doing that. So there is definitely 4 years worth plus. I mean, I don't even feel 4 years is enough now for dental school, but it's a lot of stuff. So if you want to specialize, there's additional 2 or 3 years, sometimes 4 to 6 years, to specialize, and there's a whole bunch of specialties to if you're interested in. And I think there's probably even more than this. I'm a little out of the loop probably with the specialties, but radiology, now a big thing is having a CT scan, a CBCT scan in the dental office, especially if you're placing implants. It's almost standard of care now. So I have a CBCT. I don't necessarily, I know how to scan and look through the x-ray, but if there's some questions that I have, I will send it over to a radiology specialist to take a look and make sure that there's nothing abnormal, no tumors or anything, especially if I'm suspicious of that. And I'll show you an example of kind of like a little bit of how CBCT looks like. Prosthodontics is like basically like crown and bridge. Periodontics is the gums and the bone surrounding the teeth and the health of that. Orthodontics is braces. Most people are familiar with that. Endodontics is root canals. And oral surgery is a whole bunch of things. Oral surgery is really cool. They're all pretty cool, but oral surgery is pretty cool. With oral surgery, it's not just wisdom teeth. A lot of people think oral surgeons just take out wisdom teeth, but they do like whole, like, one of the coolest surgeries I saw was in oral surgery at Bentob, and it was a person who had an ameloblastoma, which is like a benign tumor, but it's a very fast growing tumor, and it basically ate through his lower jawbone. And so they had to basically do a whole coronal cut and pull down the face, all the way down, and to expose this area right here, and replace that, take out the tumor, replace the jaw with a metal piece and screws, and then close that all back up together. That surgery took almost like maybe 20 hours. I was standing there for 3 hours. I was dying. My back was killing me. I was like, oh my God. And I left because I was a student. I wasn't doing the surgery. And I came back the next morning. They were still there. And I was like, oh my God. But that was a cool surgery. It took forever. Anesthesiology, pathology, public health, you could do more of like that's more in research and getting awareness to the community and helping the community, so that's a whole specialty as well. And for the specialties also, like each school has like maybe 2 to 6 positions open for those specialties. It's not a huge number for for each year. And so you also, if you are thinking to specialize and you go into dental school thinking you may want to specialize, it's important to keep your class rank up, and keep your GPA up, do research and kind of do the same things that you did for trying to get into dental school, because you're still going to try to get into a program. So you want to, you may want to look into being in the leadership of your school, like, and be like class president or vice president or something, and help in that way, or join some of the organizations like American Student Dental Association. And also you're going to need letters of rec, and you want to have a balanced extracurricular activities. So that's also important to keep in mind. And if you're not sure, it's still good to try and keep that up. Otherwise, we used to say C equals DDS. So, you can just pass and become a dentist. That's fine as well. But if you feel like there is a chance that you may want to specialize, you want to, keep that in mind and keep conscious of keeping up your class rank and all that stuff. Okay. So general dentistry. Why I decided to become a general dentist. Number one was like that little spoiler. I was done with school, so done with school. That's it. I did a DPR, which was a year, but it was not really school. So, but yeah, that's it. So there was no thought of me going into residency. I also like the idea of not just doing one thing all the time, although some of those specialties, like endo, really is root canals all the time. It's interesting, but I think that would be boring still after, at this time, especially since endo is down there with the on the bottom with the thumbs down, because I really don't like endo too much. But there's I just like the idea of being able to do different things and not just sticking to one particular field, or just doing one type of procedure all the time. And so, like, some of the things I love, and we didn't get ortho in our school during dental school, and maybe they have changed that now, but you can always you don't have to specialize. You can always take classes and continue education classes and get certification in different things. Like I got certification in ortho. I love ortho now. Like if I went back into dental school, I probably would go into residency in ortho, just because it's easy. I think it's easy. So, but implants, I'm placing implants. I also did courses for that, and I'm continuously taking courses for that. And implants scare me still a little bit, and that's, again, you have to find your comfort level, and you have to try things. Some things are going to be scary for you, even getting out of dental school, but you just have to dive in and take the classes that you need to take if you're interested in doing them. Also, crown and bridge, I love that, but pedo is not my favorite thing to do. I mean, I did it for years. I did sedation, conscious sedation with pedo, but still not too fun. I mean, it's hard. It's hard for me to, to cause a kid to have. I just don't want to have that kid having a bad reaction and negative idea of dentistry going forward their whole life. And so for me, it's not my cup of tea as much. And endo, endo is just crazy. But anyways, okay. So my practice, like I said, the name of my practice is Garden Oaks Dental. It's located in the Heights area in Houston, Texas, and I've been there about 14, 15 years. I worked as an associate in a corporate office for 10 years in two different kinds. One was just mainly pedo, and we saw a lot of pedo. I hated that one. It was like I was there for a year and a half, and I left that. But the other one was, pretty much just, it had a balance of different kinds of patients, and I stayed there for 10 years. And it was pretty nice. I went to work. Like I said, I've always worked part-time. I knew that that's what I wanted to do going into dentistry. Um, and so I've always worked either 2 or 3 days a week. And so when I was in the corporate scene for 10 years, I really would just wake up, go to work, and come back home and not think about anything, and then just go back, and then I would do that twice a week, and that was pretty much it. It was pretty easy. Um, Opening up your own practice is definitely a lot more challenging. I mean, I get called, I only still work 2 days a week, but I'm working a little bit every day. Like kind of, I get calls all the time. Oh, the computer is not working. This is not happening. The assistant called sick. The office manager is having a baby. Every day there's something. Every day the sink is leaking. So as a practice owner, there's so many things you're juggling. I mean, as a dentist, anyways, is like kind of a jack of all trades, but just owning your own practice is like crazy some days. It's another thing. But at the same time, I'm my own boss. I keep thinking, give it up. It was so much easier when I worked at another office, for somebody else, and I just showed up. But it's my own practice. I have flexibility. I can go on vacation if I want for a month. I mean, it's not easy. It's not that easy. Still, even if you own your practice, you have to figure out what to do with, stuff and everything. But I don't think I could go back to working for a corporate office, even though it was a lot easier. You just have to find the right fit for yourself, and I would try both. And a lot of people would before, most people don't leave dental school and then just open up their own practice, although some do, but most people don't. You try working in a couple of different places and see what works better for you and find your right fit. Work environment is so important. You want to uh, just be happy where you work and have a good staff. So if you feel like that's not working for you, or they don't treat you right, or it's always pushing like production or money, and that might not be for you, then you can try a different place and see what works better for you. And also, opportunity for growth is an important factor. And the reason I mentioned that is when I was working for corporate, I didn't, they would bring specialists in to do ortho, to do like braces, and they would bring specialists in to do like implants and stuff like that. So I didn't get a chance to do that. I mean, all my courses were in fillings and, pros and endo, all the CE courses that I would take, but I wanted to do implants and ortho. And so, really you can't do that as much in a corporate setting, but that's something you can do in a private setting. And this is my awesome, lovely staff and my associate dentist. Um, and they're a great bunch of team. Okay, so I was going to go into a case presentation real quick. It's just a simple case, but it was just really interesting. And it's just recent, actually. I got one of the pictures today, but this is the case of the perpendicular 8. And the 8 is like the tooth number 8, which is like the two front teeth are 8 and 9. You'll learn that later on. But if you can see here, I'm not sure. Can you guys see my cursor on here?
Yes, we can see.
Okay, awesome. So right here, you can see this tooth number 8 is sticking straight out instead of, coming down vertically. You can see it a little bit better right over here. It's like basically coming straight out at a 90-degree angle. And the over here, you can see how, so this is a CBCT. So these are off of a CT scan, which we bought in the office, and it costs like almost as much as a house. That's another thing, dental stuff, when you buy it for your own practice, it's all expensive. Okay, so just know that from right now. But anyways, you can see the tooth. Normally it would be up like this, and this one is like basically laying flat like a little whale. And over here, this is the cross section of that tooth, so it looks a little bit different, but you can see how it's basically cut in half, and so you can see how that tooth looks. Okay, the patient in this case, she's 9 years old. And so we weren't sure why that tooth was up. And the first thing that they sent, she's actually a relative of my dental assistant, and they sent us this picture first. So first she sent me this picture, and I really couldn't see what the mom was, I couldn't see. I just thought maybe the tooth was delayed and it hadn't come, or it was impacted, and I couldn't really see the tooth. And it's very high up. Like on this CBCT, it doesn't look that high up, but it was pretty high up. she had this little piece of tissue, so I was like, I really can't see anything. They said the tooth is up there, so I got them to send me another picture. This is all by phone. They sent me the picture. And this is the tooth right here sticking out like that, just kind of like how it looks on the CBCT. The problem with this patient, oh my God, I don't even know how we did anything on her because she was something else. But you couldn't even retract her lip. She just was so scared, so apprehensive. And then that tissue, this little tissue right here, it was in the way and we couldn't see, and she was just so scared that she was crying. So each appointment took us like 2 hours to do, and the goal of this appointment was not to do braces but just to pull down that one tooth. They just wanted to pull down that one tooth. They didn't have insurance, and they didn't want that to get stuck. And it was also, her lip was very protrusive. I do have one view. I think you can't really see it too well, but her lip was sticking out, bulging out on that side where that tooth was out. It wasn't just from the tooth, it was also from this tissue that's right over here, this soft tissue. And this soft tissue is actually pretty hard. It was thick and hard, and you can't really see how much it is because as the tooth comes down, you'll see that that tissue gets bigger. So here you can kind of see, I didn't get a side view, which should have, but her lip is bulging up over here. So it caused her to have a problem opening. Closing completely. You can also see this tissue right here a little bit better. So what we decided to do was to tie a chain. This is her, the brackets, just normal ortho brackets. A lot of times when the tooth is impacted, we'll tie a chain and pull that tooth down. And so I could not get the front of that tooth, so we basically just got we got a chain attached to the bottom of that tooth just to pull it down, to start pulling it down. And so here, and like I said, it was very difficult to work on this patient. So here you can see the tissue. That's what it covered. Every time we retracted that tissue, she was like screaming, and it was just a difficult case. But over here, so what happened is I could not get the bracket. See over here, the bracket, that chain is still on the inside of that tooth, but now the tooth has come down and it's pretty much vertical now. It's not horizontal like it was, right? So you can see that it's actually coming down. The bracket is on the inside, and we were trying to get the bracket on the outside of that tooth, on the lip side of that tooth, but we couldn't because of all that soft tissue. So what we did is we ended up lasering that tissue off and suturing it, and we did that with sedation, so she did a lot better with that. And we were able to put a bracket on this tooth, and then I don't have the final, but that tooth is down now. I think I didn't add it. I got that picture today, but I guess it didn't add into this presentation. But anyways, her teeth are very even, and she is actually going to be coming in next week to get those braces off. It took about 8 months to pull that tooth down, so it did take a little while. But a lot of it was also because of that soft tissue in the way. And one thing I forgot to tell you is, going back to the CBCT, one of the main concerns that we had, and I sent this over to radiologists as well, just to make sure there was I don't see a tumor or anything, but just to make sure why that tooth was out there like that. We weren't sure if there was like a cyst or something around that tooth that could be causing that tooth to come out perpendicular. So I had it read by a radiologist, and then they sent it back. They said they didn't see anything. I didn't see anything, so we went ahead and pulled down that tooth. But so we kind of did the radiology, sent it over to there. We also did some laser soft tissue. We pulled down that tooth, and it's just a little bit of a different kind of case. And I wish I had the last picture, but in the end, her teeth are even. She's ready to get them off. So I mentioned giving back to the community. I know we're close to running out of time, and it's just really important. I'm kind of a volunteer junkie, and so that's important for me. When my kids were in school, I was always on the PTO, like I said, and I would always tell the teachers, okay, listen, I work 2 days a week, so do all the field trips on those other days, okay? Just write them down right now. And so I was pretty much always at their field trips. Not that they don't remember these things. So I don't know, maybe just work 5 days a week. But anyways, Yeah, so I was always volunteering at the school, but I also do go to the Shifa clinic still. That's where I got my start. That's where I shadowed. These these over here, this is Wasim and Abdurrahman Mercy, and I got permission from them to post this picture, and they just got into dental school this year. Abdurrahman is going to Florida, and Wasim is in San Antonio, Texas. And so just, making people happy. This is a clinic that where people wouldn't be able to get their teeth treated if not for the pricing at these clinics. They're very, very inexpensive. Instead of doing like $1,000 for like a deep cleaning, it's like $45 or something, or $50. It's not expensive, and so you can provide that service, and it makes you feel good. We used to do a lot of health fairs. We haven't been doing anything because of COVID right now. Even Shifa Dental right now is unfortunately closed, and that's um, mainly because of concerns for the students who are volunteering there, because they're not trained exactly in infection control, and I think they don't want the liability, but unfortunately it's closed. There's also MCC Dental Clinic, which is the multicultural center, which I serve on the board for, and we just opened that up. That actually opened up right before COVID, and then we had to close it, but we're back up. We're doing very minimal procedures, just mainly exams and cleanings, but hopefully eventually we will be doing more procedures. Give kids a smile. I participate in that. I try to do that every couple of years, and every year during February I give a talk to the school. During dental health month, sometimes I'm asked, but I always go to one specific school because it's my kids' school. They're not in there anymore, but um, that's cool. And then giving back to the community in other ways. Like I said, I know a lot of dentists who are very helpful. I think our we have a lot of generosity of spirit as a group, and a lot of the dentists I know give back to the community in some way. I am on a whole bunch of different organizations, and as founder and board, and I enjoy doing those things. I like having, and that's one of the reasons I also work part time still, even though my kids are older, is because if I worked every day, dentistry is tiring. It's a very physically um, tiring profession. I mean, because you're pretty much doing procedures on patients all day long, kind of bending over and doing stuff, and it's very fast paced. And if I did that every day, I would be too tired to do anything else. So, like I said, I continued working part time just because I like to do a lot of different things, and I like to help the community. So it's really important for me. And but hey, if you like to play golf or do other things, by all means do that as well. It just, you have a lot of flexibility in dentistry. And I think that's pretty much my presentation, so I'll stop, and if you have any questions, please feel free to ask.
Yes, so now we're gonna move on to the Q&A. I'm checking if there's any questions here. And then we'll get started. So one question I have here is that you said that one reason you chose dentistry is because it's constantly changing. Like, how has it changed since you began in the dental field until now? Maybe technology-wise or anything new?
Technology wise, but even still, like and when I first left dental school, there were not that many dentists placing implants. Now a lot of general dentists are placing I mean, not as many general dentists placing implants. I mean, there were a lot, but there was not that many. Now it's pretty much like most general dentists will be placing implants. So that's one thing. And also, we didn't have CBCTs. We didn't have like those x-rays. Now they're kind of, if you're placing implant, it's really a good idea to get a CBCT. Like I said, it's not that easy because it's almost as expensive as a house, but it's worth it, and you can see so much more clearly on the CBCT once you know how to read them. So that's one thing. I mean, that's a small example. I mean, there's certain fields that haven't changed as much, like endo, which is the root canals. It's similar. Now that's another thing. When we were in dental school, it was all hand filing. So we did everything with hand file. A lot of people still use hand files, and they use hand files in between rotary, but now everything is rotary, like it's on a handpiece, and it's electric. So it's a little bit faster. It's actually a lot faster to clean teeth. Sorry, to clean out the nerve from the root when you're doing a root canal. A lot of the different materials, like in prosthodontics now, we have zirconia, which was not a material when I graduated, that was used that much. And there was a lot more gold used when I was in dental school. Okay, but of course I'm dating myself, but yeah, like gold was used a lot more. We had porcelain fused to metal. I hardly do any porcelain. I mean, I haven't done any porcelain fused to metal in years. I don't know how long. Um, I did gold foil in dental school, which that was actually old at that time. I actually took a special course. I do not know why I took that special course in gold foil, because that's totally obsolete. Nobody does gold foil. Nobody even knows what gold foil is. But it was like a technique of packing like this like thin gold beaten foil of gold like into the tooth, kind of like a silver filling. We did a lot of silver fillings. Now I haven't done silver filling in like over 15, 17 years. So I mean, those are, and not that they're bad fillings. I mean, but there's a lot more. There was a lot more hype. There was a hype about mercury in the fillings and stuff like that. Those fillings actually hold up really, really well. They still do. So there's a lot of changes in dentistry, and it's constantly changing. Now, not just they do implants, like one implant, but now they're doing all on fours, where you're extracting the teeth and then you put dentures on top of the implants, or you by putting like about like four implants in, and then putting teeth on top of that. And so it's more sophisticated and now, and there's just, and I don't even do that still. And those are some of the classes that I still want to take to do. But those used to be only done by prosthodontists, and now they're being done by general dentists. Yeah, so there's a lot of changes. It's constantly changing. And there's so much, now lasers is huge. So just even with cleaning the teeth, and with endo, with all the residency, I mean, all the specialties or the subspecialties, laser is being used. You can use it to contour some gum tissue for aesthetics, like if you have a gummy smile. If like we took off that tissue from that girl, that case study that I showed you, that was in the way, it was in the way of us, so we just lasered it off. It was so easy, and it cauterizes it, so it's not bleeding as much. You can do it around crowns, you can do cleanings, go in the pockets with laser and clean out and kill the bacteria that way too. You still have to do the cleanings, but it sanitizes those pockets even more. So I mean, there's so much that's you nowadays too. Like we used to take impressions all the time. Now we have scanners, digital scanners to take impressions. So now with like, and then there's invisible braces. There wasn't invisible braces, when I was in dental school. So there's so many things and that's something I do as well, invisible braces. And it's pretty easy. A lot of general dentists are doing that, whereas they may not be doing traditional ortho, but they do that because it's somebody else pretty much manufactures those trays and stuff, and then you just monitor. So it's a lot easier. But yeah, there's a lot of technology that's evolved and is constantly evolving. So you're gonna be learning all your life pretty much. um yeah.
Very interesting. So another question is, have you done research in college or dental school, and how was it, and was it helpful?
So I didn't actually do research. I never did research in either one. So I kind of thought I wasn't going to go into specialty, so I didn't do anything really too much in dental school. GPR was like very last minute that I decided to do that. But in an undergrad, I moved from college from California to Houston, so like I didn't get a chance to really do too much research. So I never did that. I did shadow, I did volunteer at different things, but research was never something that I actually did. Yeah. So sorry, I can't answer that one too well.
Everyone does research.
Yeah.
Okay. Another question is, what would you recommend to someone that decides to take a gap year?
Um, So I actually, it's a long story, but I did take a gap year. You want to make sure that I feel like gap years sometimes it can throw you off. So um, you want to make sure that you stay focused and you do something. You don't just sit and play video games all day long, but that you actually, have deadlines in mind for when you have to apply. Keep that, and if you didn't do that well in your DAT, maybe you can study for your DAT again because you're, in a gap year. Working, you can work as a dental assistant, get trained as a dental assistant, and work as a dental assistant. That gives you so much exposure to what it's like, really like in a dental clinic. I know sometimes it's really hard to, it's not hard, it's boring to shadow dentists because you really can't see that well. When you're standing like about 3 feet away from the patient and their little, hole is open, you really can't see too much. It's hard to see in the mouth like what the dentist is doing. So after a while, it kind of gets boring when you're shadowing because you really can't see. But if you're assisting, you're actually there. You have, you're attracting, you're sectioning. You can see everything that's going on. So it's really, really great experience. So I tell a lot of people that if you can, uh, get a job as a dental assistant or and get the certification for that and work in a dental office. That's great experience, plus you're getting paid. And there's a shortage right now of dental assistants, so that would be a great thing to do. Also, research is great to do. I didn't do it, but it's a good thing to do on your resume. So, if you find a research opportunity, go for it. Or if you want to do a master's in something, you can do that. I just want, you should be busy though. You should be productive during that gap year. You don't want to just, sit and wait and, have nothing to show for it. So, and always have your bases open because it's not a guarantee that you'll get into dental school. Dental school is competitive to get into. Sometimes I know, a couple people, tried a couple, 2 years, 3 years, but hopefully that doesn't happen. But you want to have your bases covered always. I feel like don't just sit and wait for it to happen. It might not happen, so do something proactive during that time so that you have something to fall on it, in case it doesn't happen for you right away. Yeah, but pretty much, just stay focused, and try and do something that you feel is a good fit for you.
And I think we have room for one more question. So I have a question here that says, if you could change one thing about dentistry, what would it be? That one's more creative.
Yeah, that's so one of the things that makes dentistry a little bit hard for me, personally, this is from a personal point of view, is it has such a negative, um, there's a negative stigma, I guess, associated with dentistry, like from the patient's perspective. People are scared of the dentist and they don't trust the dentist. And so and it's propagated in movies because you see it all the time. Like the dentist is the crazy person who kills all the people, or what, I don't know. They're the serial killers always. Anyways, I don't know why they do that, but it's dentists and lawyers. We're not trusted. So I wish there was, something to change that narrative. And I don't know. I mean, but you can just try, because that does cause a stress. I mean, you don't know how many times I hear like every day, like, oh, I hate going to the dentist. No offense, but I hate the dentist. And I'm like, yeah, no, I've heard that before. And I in fact also, do not love going to the dentist myself, but it's something that everybody has to do. But it's just changing a little bit of that narrative, and I try to do my part to explain everything to the patient and to make them feel comfortable, before we do procedures, and to try and alleviate any of their concerns, and if they have, apprehension, to try and help them with that, like, uh, through some of the means that we have, like some of the sedation dentistry options, so it's just, yeah, that's something it's the only thing I can think of right now.
Okay, and in the next two slides, we have our socials for your clinic. So if you could.
Oh, sorry. Yes. Okay. That's me. Okay. So, I'm on Facebook. I'm not on, I don't think I'm on Instagram, although I did do a TikTok. You guys might want to check me out. I think it's She's a Man, like, because my last name is a man. and it's she's a man, because I always tell patients if they don't remember my name, I'm like, oh, I'm a man, but anyways. um, so it's at Garden Oaks Dental Houston. If you want to find me on Facebook, I'm there. And then our email is info@houstondental.net. And I didn't add my website, but it's www.gardenoaksdental.com. Yeah. And then this is Fresh Dental Shadowing.
Yeah, our Instagram and YouTube are both Fresh Dental Shadowing. And then I'll be posting up the quiz on our Instagram in the link tree so you guys can take it. Well, I want to say thank you for everyone for tuning in, and thank you, Dr. Saman, for your time and your advice.
Great. Thank you so much for having me. I appreciate this, and good luck with everyone out there applying to dental school. And, if anybody has any questions, feel free to message me. My email, again, I'll get the email. So info@houstondental.net. That's probably the easiest way to send a message, but you can do it on Facebook as well. And I'm happy to answer any questions. I hope you learned something. But dentistry is a great field. So, if you're interested, go for it.